Welcome, welcome. Today we have with us Dr. Sumko. He is the orthopedic surgeon here at the Tanner Clinic in Layton, Utah. Today we're going to talk about the pros and cons of robotic-assisted surgery. Thanks for being with us.
Yeah, absolutely. Thanks for having me.
Yeah, no problem. So first, before we get down to the nitty gritty, we'll just do kind of a little get to know you question here.
Sure.
Which is, can you introduce yourself and share a little bit about your background in orthopedics?
Sure. So yeah, I'm Dr. Dan Sumko. I have been on my own out in practice after training now for about 4 years. This is my first, practice location. I did my medical school at the University of North Texas in Fort Worth. Residency training for 5 years after that in Harrisburg, Pennsylvania. And then I did a 1-year subspecialty fellowship, just specializing in hip and knee replacement. And again, since we're on the topic, throughout those had both, non-robotic and robotic-assisted training through my training time. So anyways, we've been back. I'm from Brigham City for the most part. And so.
Me too.
Oh, cool. Yeah, so we small world. And so we have this chance to come back and be relatively close to home and close to family. And we took it and we haven't regretted it for a second. It's been amazing to be back in this area. And we love the people and the community and the location. It's awesome. So couldn't be happier.
Awesome, sweet. And then now into the interesting stuff. I'm super excited to honestly learn about robotic-assisted surgery. I don't know a ton about it, and I think it's pretty fascinating because I kind of feel like it's
it was like leading the future, right?
Yeah, exactly. Sounds pretty futuristic stuff. So the first question, or the first question we have here is, what is robotic-assisted surgery, and how does it differ from traditional surgery?
Yeah, so when you're putting in, we'll talk just hip and knee today, when you're putting in orthopedic implants, you're making cuts and you're trying to balance tension on different ligaments and structures and get things aligned properly. The traditional way of doing that, which was a big part of my residency training, is just using, different guides and things like that you place on the bone, and then using, which isn't a bad thing, your own feel and sensory feedback to say, yeah, this looks aligned well, it feels good. The robotic way is a more of an objective way where you actually have numbers, and I can look and collect data for the knee, for example, and say, this gap is, 10.1 millimeters, this one is 9.7, but if we change and manipulate things, we can theoretically align them better. But I know we kind of talked for a minute before, what we're going to talk about in the future is, does this really change things? Is this really make a difference? And so I think that's the question that we don't really know yet, right? There's lots of people who are doing no robotics, there's people who are doing all robotics. I'm kind of a weird hybrid where some of the facilities I go to don't have a robot, and some that I go do. And so I do some with and some without. And I don't mean to spoil the big reveal at the end, but I so far with my patients, I haven't noticed a big difference yet. But I do think that there's certainly some applications where robotics are advantageous, so we can talk about that.
Perfect, sweet, thanks. This is something that's super interesting for me, is how does the robotic system assist you during the procedure?
Yeah, so there's several different kinds, even in this subset of orthopedics, like we talked about, you and I before. In general surgery, there's like the Da Vinci robot, which is kind of small little, robotic hands that assist with smaller, motions and things in surgery. In the orthopedic world, it's usually more of a saw or a burr that's attached to like a big robotic arm that comes in and helps you make your cuts or ream the acetabulum, for example, in a hip. In addition to the robot itself, it always comes with some kind of computer software that you can see, and helps you kind of align things and position your implants before you make any cuts, which is really nice.
What are the biggest advantages of using robotic technology in a joint replacement?
Well, I think the good and the bad of it is that it's, objective feedback. What I think you have to be careful is to not say, you have to look at robotics as a tool, right?
Yeah.
So someone can use a tool poorly or use it well, right?
Yeah.
And so there have been times where the robot has told me, this is what this gap is, or this is how you should cut this. And it just, to my eye and to my feel, I don't agree with it. And so I'll deviate from the plan and have to trust my own, instincts and experience and things like that. So I think that's kind of the big advantage, though. It's nice at the end of a surgery to look up and say, not only does it feel good to me, but I have objective feedback from the robot that tells me this is a well-balanced and well-aligned knee. And so I think it's not necessarily, 100% necessary to do it that way, but there is some advantages to it.
Yeah, and just kind of comment on what you said there. Something that I think is really great is with you being more hybrid is you can really look at it. Okay, does this actually make sense?
Yeah.
And then go with your actual decision with what your actual education is about.
Right. So that's the concern is what if, the next generation of surgeons trains only on robots their whole time and they don't develop that, kind of ability to do this. What if the robot breaks in the middle of the surgery, right? There's stories of that happening. Do you have the training and the know-how and the ability to get yourself out of that situation? So I think it's important to not completely rely on robotics, but try and find this balance of where we're using technology to get better, to get more precise, to get more accurate, things like that.
Yeah, I like that. Have you seen, what you already kind of touched on here, is have you seen faster recovery times or better long-term results due to robotic surgery?
Again, like you said, I think I'm kind of unique. I think the guys are either all robotic or none, and I'm kind of a hybrid. And I was convinced when I first started, I thought, oh my goodness, my poor non-robotic patients, they're gonna do so poorly because they don't have this technology. And truly, I haven't done any, metrics and studies and stuff like that inside my own practice. But when I see somebody post-operatively, I can never tell if they were robotic or not. They seem to do the same.
That's awesome.
Cool. And I would say studies, as far as outcomes, would tell you the same. There have been some studies to say that robotics gives you kind of decreases the outliers, is how they say it, meaning more consistently you're within this range of 3 degrees or whatever, you know what I mean, of alignment and things like that. But there haven't been any studies that I know of that objectively say robotic patients do way better. So.
Okay, yeah, that's good to know. And then kind of similar, but on the other coin, are there any drawbacks or limitations due to robotic surgery? I
don't think so. I don't see any negatives about it. There is an increased cost that comes along with it. So the machines can cost up to $1 million, and then there's maintenance on top of it. And then in addition to that, there's also small tracking pins and things like that you wouldn't use with a non-robotic surgery. So I do see it, driving up the cost of healthcare over time.
Yeah. From
the other side, kind of playing devil's advocate, suppose robotic surgery is better and lowers the amount of redos or revision surgeries. Those revision surgeries are massively expensive, right? So if you can cut out a couple of revision surgeries, the idea is that you'd make up that cost over time that you're paying for these robots.
Fully. And kind of just to go with that, is that cost, I imagine, passed on to the patient, or is it kind of covered by insurance?
It's all yes and all around. Yeah. So, the facilities are typically paying for the robot.
Yeah.
The facilities, it depends on the type of contract they have and things like that, as far as who's eating the cost for the different trackers and things like that. But typically, to my knowledge, no increased cost for the patients. But between the insurance and the hospital, they kind of work out how much they're going to pay the facility and those kind of things.
That makes sense. Do you think robotic assisted surgery will become the standard for surgery in the future, or what are your thoughts on that?
I think so. I think it's going to take more studies. What's tricky with the studies on robots is they're often sponsored and paid for by the robotic companies, right? And we know that industry-sponsored data is often tainted a little bit. And so what we need are good, objective, non-sponsored studies that show that. I'm kind of unique. I think robotics are great, but I don't feel like I have to have it in my practice. There are certain situations where I really like it and think it shines. One is partial knee replacements, where you're just doing one compartment of a knee, for example. That is really helpful to place your component precisely and kind of get a 3D idea of where that will be before you make any cuts and things like that. Another is, hip or knee replacements where there's hardware around the joint, like screws or plates from a prior surgery. Then it can be really advantageous to say, look, we're going to avoid this, screw or this plate or this, object that's in the way. or sometimes you can't get the manual instrumentation, the non-robotic instrumentation in or around the joint if there's hardware blocking it, if that makes sense.
Interesting.
Yeah, so for example, if you need to put a guide rod into the femur, but there's already a rod in the femur from like a prior trauma, then, you know, robotics or different kinds of navigated technology can help you get that same information, but without having to remove the hardware. So,
Okay. Just out of my own curiosity, is it just because it's able to sense where it's at?
exactly, yeah.
That's
So it
where-
goes off of the hip motion and the hip center
Okay.
and collects the same information that you would want to get from using that guide rod the traditional way. So yeah, good,
Yeah, that's cool.
good question. Kind of advanced stuff, but yeah.
Yeah. And then what advice would you give someone considering robotics?
I see this question asked on social media and things like that, and seen some other doctors chime in. I think the best thing is go with what your surgeon feels most comfortable.
Yeah.
I think when you see complications or poor outcomes or just unhappy people or doctors, it's because they deviated from their standard plan. And so that's why I try and tell patients when they come and talk to me is, you know, this is what I think is best for you, and this is the way we should go. And I hope that they feel comfortable and we find a solution that we both agree on. But I would just say, go to a surgeon who's confident with what he has in his hands and go with that.
Totally. And then this last question kind of really just allows you to put a plug in for yourself is, if someone is interested in having orthopedic surgery, how can they get in touch with you guys?
Yeah, so if they just call Tanner Clinic here and request an appointment, I have openings, and my PA, who I recently hired, has lots of openings. We get people in really fast, within a day or two typically.
Awesome.
And I just opened a surgery center up in North Ogden in Far West, just off I-15, and then also have partnered in with another surgery center in Layton, where we have, you know, block time available and time to get in and get you taken care of quickly. So
Awesome. Sweet. Thanks so much, Doctor.
no,
Yep.
thanks for having me on. I appreciate it, man.
Perfect. Thanks.
Yep, we'll see ya.